The meeting's order. I'd ask everyone to please rise. Vicki, would you lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Hey, this time, let Nikki introduce our new board member.
We also have a staff person, so maybe I'll have them. Diane, our new staff members, and I'll introduce herself.
Good morning, everyone. It's wonderful to be here. I'm the new grant writer here at District Health, and I'm here. He's a lot in not too many hours, but I've been a grant writer. Programs that all around us. I'm still learning what I'm building and learning, meeting a lot of people. But, thank you.
And I think this should have been your honor, Mr. Chairman, but we have a new board member. For him, but Commissioner Joe Hubbard, I don't know if you want to share anything about who you are or not, but you're welcome to the board.
Just another innocent soul that got roped into something else. So I'm glad to be here. I'm learning an awful lot since I became elected, and I'm sure I'll learn more on a day-to-day basis. But so far, it's been good. I haven't had any real bad experiences or anything. A lot of it's just life. I'll do what I can do.
It was great visiting with you last week and my orientation. It was great to get to know you a little bit, and I think you'll be a great asset to this district. Thank you for being a part of it. I'm sure the commissioners know. Thank you so much for being a part of it.
Thank you.
I've moved. We have great board members, so we can be a part of it, and it's great to have you here. This time, I'll do roll call. Commissioner Purdy. Here. Dr. Tribble. Here. Commissioner Hubbard.
Here.
Commissioner Reevy. Here. Commissioner Brooks.
Here.
Commissioner Butici. Here. And I am here, of course. Is there, everyone had a chance to look at the agenda? Is there any request to do any changes to the agenda that can be only action or only information or guidance?
Sure, I would vote we approve the agenda. Would we approve the agenda? Second.
It's been moved and seconded that we approve the agenda. Is there any further discussion? Hearing none, all those in favor?
Aye.
Motion carries. Is there any in-person comment? Nope. Okay. At this time, I would ask for approval of the December 2024 meeting minutes.
Mr. Chairman, I move that we approve the December 2024 minutes.
Second.
Okay, it's been moved and seconded that we approve the December 2024 meeting minutes. Any further discussion? Hearing none, all those in favor?
Aye.
Aye. Motion carries. Okay, at this time, I'm going to ask, I'll turn it over to Nikki.
In your board packet, we have attempt number 2, I think, to get our calendar for the 2025 meeting notices approved. We've updated, we had a cancellation of the January meeting, as you know, and then we also had a conflict with one of the IEC conference dates. So we have adjusted, I think it was September to make sure we don't have that conflict. Those are the only changes.
Mr. Chairman. Yes, sir.
Trina, did you send this to Monica and Jenna?
No, but I will after it's approved.
Thank you.
Yeah.
How's the roads up in your area?
Pretty good.
Does everybody have a chance to look at these? Everybody good? Sure. Okay, now is, if everybody's good with that, we'll move on to the,
Did we vote on that? Do we need to vote on it?
why not? If you want to vote on it, we can approve it, since it's been amended.
Yes, it's an action item and I do need that.
Mr. Chairman, I move that we approve the amended scheduled meeting notice as presented.
Second.
Okay, it's been moved and seconded, we approve the second amended meeting notice. Any further discussion? Hearing none, all those in favor?
Aye.
Thank you. Don Lee.
Sorry.
You're up, dude.
I'm up.
I feel for you.
Yep.
I assume everybody knew that we lost Troy. Anyway.
Thank you, Commissioner. So Troy Cunningham was our fiscal officer. He retired about a month ago. And so we are kind of in a learning phase on how to do all the myriad of wonderful things that Troy took care of quite well for us. So we have our monthly expenditure and revenue report. Since we didn't have a meeting last month, we have updates both for November and December. If you recall, those are offset to allow all the appropriate items to find their way into Luma in their correct location so that we can pull an accurate report. So if folks want to go through November, we can, although probably December's a better snapshot of our most recent status. We're halfway through the year, and as you can see in that right-hand column, the various categories, county fees, county contribution fees, contract revenue, et cetera. Those are all trending on track with where we would usually expect them to be at this point in the year. No areas of significant concern. We do have a plan to submit a slight change to our budget just to move some dollars from one location to another, but no net change in the total amount. Just move it from operating to T&D. So it's based upon how some of the contracts are set up. It just helps have the things code to the right location. If folks have questions, I'll do my best to field those in Troy's absence.
It shows the fees from the revenue are up.
Correct.
Is that for septic or what's it called from, do you know?
We have, yeah, you can see there in the environmental health, we're having, usually during when the weather's cold and folks are not moving dirt as much, we have less permits and such coming in, but we've had a pretty steady inflow of activity throughout the district in that area, so.
I'll add to that, when we assess the fees for food licensing in December, so we're often kind of behind in fees, and then when those hit, they kind of bump us up, and so it won't look as great. We'll normalize, I guess is what I'm saying, probably over the next few months. But I know our fee revenues in lands have been remained higher than maybe we expected they might be as well, so a bit of both.
And looking forward, although that's not necessarily on the agenda, looking forward, we'll have a new fiscal officer starting on Monday, and we'll be introducing him next month.
Awesome.
I'm sorry?
That was quick. Positions don't get filled that fast.
No.
Good.
Fortunately, we had some good candidates apply for our skill position with good finance backgrounds, and so we were able to kind of pull on some of those and see if there was interest, and there was. And so we were able to move quicker than,
That's
to
good.
your point, but
On the crisis center, youth crisis center, on the revenue side, it shows it at 221%.
yeah, that's part of what
Dawn was referring to for the buckets of funding. So when the transition from health and welfare to Magellan happened last year, it was not in the projected budget. So we'll be moving buckets, and then also, of course, the construction was finalized on the new crisis center that's open over off Hawaii. So yes,
Just trying to make
Yeah.
sure that we're transparency of where the money's going.
Absolutely.
What we're doing. Anyone have any questions? If not,
Can you explain about 0% on the new prices? Right there. On capital outlay?
that would just mean it was not projected in the budget. So when we look at, so part of that money was funds that were carried over from prior funding streams. So we got county and city funds that we hadn't done construction on. So it's just moving the buckets to make it accurate in the reporting in Luma, which we haven't had a chance to present to you guys yet.
Okay, I got you.
Yeah.
All right.
any further questions? Well, thank you, Don. Great. Appreciate it. It's time, we're going on. Turn it back over to Nikki for the pre-prosecution.
I also have Vito here, so if I need to help answer any questions. As you recall, we have a pre-prosecution diversion program that we're running in partnership with Canyon County. And one of the funding pieces was to find a location to house the pre-prosecution diversion program. So we've gotten to that stage in our program development. And Vito has been looking for some places for quite a while now, and found a place that he thinks would work. The prior prosecutor has had kind of given his blessing on this location. We had been in talks with them, but they then had ended up leasing the location, or moved forward with leasing location to another entity. That fell through, so they've come back to us. And since that time, we now have a new prosecutor, which Vito's told me he'll be meeting with him tomorrow. This will be on the list of things for them to discuss. But since the board approves all leases of property, I wanted to give you guys the opportunity. This is just an MOI, to see if you have any questions or concerns about the contents here, so that we have some thoughts to bring back to the property management company if we decide to move forward with this direction. Vito, is there anything you'd like to add?
Not a whole lot, other than that, but it's been a long time searching for properties. This is the one that met all of the parameters around the scope of work for the grant, that being close in proximity to the courthouse, along public transit, and accessible to decrease barriers to access and treatment. The purpose of this building is very much to be a co-located facility where different agencies along the social services and behavioral health can all be in the same building. The big goal is to decrease barriers. So instead of saying, hey, here's somebody who can help you with housing or employment, they're 3 miles away, we can say, now they're just down the hallway. So this will open the door very much for us to start MOUs with other agencies to get them in that building with us, and pursuing that route to really provide wraparound services for this population, and along with other clients outside of the diversion program.
Will that necessarily then the outside offices reduce to centralize? Is that what we're talking about, or is this kind of an addition to what the offices that we currently have?
This building has,
Will we be losing anything as we're gaining, I guess is my question.
I don't believe we'd be losing anything, no, if I'm understanding.
So all the current obligations will remain, we'll just add that office space.
Correct. If I understand correctly.
It's paid for by the grant, though.
Yeah, so to that point, it's paid underneath the grant, so it won't cost Southwest District Health anything. In the letter of intent, memorandum of intent, whatever it's called, we're expiring it, that lease, if they even agree to having us there by the end of the grant period. So it won't fall back onto Southwest District Health to cover anything in case we can't get ongoing funding for the diversion program. And then location-wise, it's here in Caldwell, off of the boulevard where it connects to Blaine. It's above Stewart's Bar and Grill in the Willows building, if you're familiar with that area.
And what is the staffing that you expect? And so this is 2,600 square feet roughly. How many people do you expect to be working in that building?
To start off working in that building, it will be 3 of us, myself, the case manager and peer support specialist currently with the diversion program, and the other office space, we're looking to have up to 10 individuals working out of that building, and they'll be among different sectors of those social services and behavioral health. And that's one of the reasons we kind of delayed things, is we wanted to get the program up and running because we didn't want to be sending money into empty space that we couldn't be filling and utilizing those services.
And was this the size space you were looking for, or does this give you a lot of room to grow if this potentially takes off?
Yeah, so I was looking around the 2,500 square feet realm, because that's kind of, from everything we've seen, you can fit a lot in. And this building with the layout, there's a lot of opportunity to put up cubicle walls and expand it. And that entire top floor is unoccupied. So if we really boom and have the need, we could potentially jump into the other side of that, which is larger than the space we're looking at.
And the grant covers all of your, whatever remodel you're going to need to do with furniture and all of that.
Yes, the majority of the money for the grant was really designated for this building to cover the lease, the office equipment, the reconstruction if needed, all of that. So this should not by any means cost Southwest District Health anything. It should 100% be covered underneath the grant.
And what's the end point on that grant?
June 2026. June 30th, 2026 to be specific.
So just a year a little bit. Okay.
Are any of the other services located there? I mean, you said the whole second floor is empty. So basically, we're there, we build it, and they'll come kind of thing?
Exactly.
Well, is this where the courts will make that decision if they go to that rather than to somewhere else, or how's that going to work?
With the individuals in the diversion program?
Yeah.
So they'll go there for services, yes.
And that'll be the diversion will be done by a judge.
The diversion goes through the prosecuting attorney.
Prosecuting attorney, okay. I remember that now, thank you.
And how soon do you expect this, if we proceed with this, how soon can you be up and running here?
If they agree to it, get in there, work on getting all of the electrical in there, order desks. I imagine once we have keys, probably 2 months of being operational, just by getting all the furniture paid for and then delivered, and then working with IT to get the internet set up and networking. So being optimistic, I want to say 2 months once we have keys.
So this is a big lift for a potential 1 year operation. It's good program.
Mr. Chairman, I'm in favor.
He said he's in favor.
Oh,
We were just looking for guidance on this. It's not an action item at this point, but we will come back once we have assuming this moves forward, we move forward with this facility. We'll come back with that action item.
If this doesn't work, if they don't accept it, or if this doesn't work, do you have a backup plan? Or you're just going to look for another location?
We will continue looking. It has been very challenging with the market space, especially when you look at the price per square footage. This building is significantly less. Typically, it's anywhere between $18 to $28 a square foot per year. So for this to be in that $15 realm is amazing, especially with its location. And even a lot of those buildings I'm looking at, they're hollow shells. The best way I can describe it is imagine a Verizon or T-Mobile. So you walk in and it's very much built for kind of a strip mall outlet. So the turnaround time to then build and put up walls, put up office space would even decrease more of our actually being able to provide services, where this one is very much move-in ready, where we just have to get the furniture and networking going.
Where's the grant coming from?
It is a state grant through the Department of Corrections and I guess sponsored by the Behavioral Health Council.
Okay. Any further discussion? Okay. Okay, now we're going down to an action item on the Board of Health leadership positions. We can start with the chair.
Are you looking for nominations?
Nomination for chair.
You want to still do it?
As long as it's okay with the board, I'm fine. It's the board's decision, not mine.
I would nominate Kelly Aberstary for chair.
I second.
Okay, it's been moved and seconded for me to continue as chair. Is there any further discussion? Hearing none, all those in favor?
Aye.
Okay, motion carries. I will be your chair for one more year. Thank you very much. We do need to elect a new vice chair. So,
Mr. Chairman, I nominate Commissioner Zach Brooks for that position.
Seconded.
Who was the second again, please?
Mr. Chair, are these one-year positions or
we do it annually.
annual?
We can't do it on, go ahead.
I do have a question. Historically, we've done this in June. The board last June asked to wait because we knew Commissioner Haynes was stepping down and they wanted to wait until January. So I don't know if that there's a reason why we would need to do it in June, if we want to move it to January or February now.
January is a better deal for most commissioners.
Agreed.
We discussed that because in January, if there's commissioners going off, there'll be new commissioners here. And so, you know, it's better for January than for June.
So I'm okay with that. If you guys are okay with just doing it in January, not
And we do the annual,
Sounds good.
just because annually, generally every 2 years, we have a completely new board because that can be by the election. You know, every year it should be let the board decide if they want what for leadership and not just to go. I think it's better to have an annual. Personally, I don't know.
I think it might actually be a statute.
For June or for?
That was for annual.
Yeah,
Oh, right.
election. Anyway, we do have a motion on the floor for Zach to be vice president. Vice chair, I should say. We would like him to be vice president, but we'll go with vice chair. Anyway, that would be quite the upgrade, huh?
Yeah.
Anyway, is there any further discussion? Hearing none, all those in favor? Aye. Motion carries. Thank you, Zach. And you will be available sometimes when we do whether it's virtually or in person, when we do the budget or agenda.
Yeah.
Yeah, okay. Thank you. Okay, all right, now we're down to communications, 2024.
Sorry, there's two other positions.
Oh, sorry, I'm sorry.
Trustee.
Trustee and executive council. At this time, we'll do the executive council. And at this time, our executive member is Vicki Purdy. So I would ask what the board wishes to do, but I personally would, if I could, I would nominate Vicki Purdy to continue as our executive board, our executive director.
Mr. Chair, can you remind us the responsibilities of that position?
Because it used to be one position, but then we changed.
Yeah, we
Yeah,
changed
we're the only district that has
it to
two people filling it, but the It's easier to talk about the trustees, so maybe I'll do that first. The trustee position is defined in statute. Their only responsibility is to determine, to work with the other trustees of the other boards of health and determine how state appropriations are divided among the 7 districts. And now that we don't have a general state appropriation, that responsibility is much less, but we do have 3 different appropriations that go through a formula still.
Millennium Fund.
And fund, citizen review panel is actually written in statute, and then home visiting. So.
That doesn't change it doesn't change it much anymore, where before, when it was state, before the Bill 316 came into play. The state funding was quite a bit more, a lot more involved, but back then, between the county and the states, we were paying anywhere from 35, somewhere around 35% of the budget overall, and right now we're around 20. The county's paying about 8% of the budget. It's changed over the years. They put more contracts and fees, so our numbers are actually going down, which has been good for the counties. For this end of the state, anyway. Maybe the other end of the state isn't so great, but this end of the state.
The executive council position is described in the bylaws for the Idaho Association of District Boards of Health, and that is more on the policy side, so they're usually more active. Sure, Bertie can speak to this during the legislative session and kind of leading up to that to help develop resolutions and policy positions for the public health districts, monitoring bills and things like that in the legislature.
But the health districts are the ones that create and support resolutions. It's not like the executive council is doing that.
Yeah, that's usually done leading up prior to the annual meeting, and then at the annual meeting is, they review and approve those collectively for the upcoming session, and then those position statements then or resolutions can be used by the executive council to stand behind, or if there's something that comes up unexpectedly, they can navigate that during the session.
Mr. Chairman, did you make a motion?
Well, I would like to, but I don't know if the chairman should, so I would prefer.
Well, I'll make it for you. I'd nominate Commissioner Purdy to the executive council position.
That's second.
It's been moved and seconded that Vicki Purdy continue on the executive council. Any further discussion? Hearing none, all those in favor?
Aye.
Any opposed? Okay, motion carries. And now we have the trustee, and I'm the trustee at this time. And up to the board, what their decisions are on that. We don't have a lot to do, so it's a pretty easy one to sit on.
You're okay to continue that responsibility?
There's not much to do, so.
One, 2 meetings a year, maybe?
Yeah, and that's, I get on the phone or Zoom and listen. That's pretty much all it is. So, anyway.
Mr. Chairman, I move that I nominate you to remain as our trustee.
Okay, it's been moved and seconded that we nominate to continue as the trustees. Any further discussion? Okay, hearing none, all those in favor?
Aye.
Okay, motion carries. Okay, now we're to Monique.
You cleaned me out last time.
Commissioner
I
Purdy.
was. Oh, thanks. Hello, Podium. Hi, good morning. Good morning. I think I know most of you, so I'm Monique Avancic. I'm a smaller person, so I'm just gonna stand up here. I'm our communications manager and our public information officer. Good morning, commissioners, doctor. I haven't met you yet. Hi.
Jim Carter,
Jim.
Commissioner from Washington County.
Excellent, yes. New face. So I'm going to do my annual year in review on communications and what I do real quick, and feel free to just interject as we go. Okay. So let's see here. So part of my role, internal communications, external communications, program promotion, and public relations. That kind of encompasses what I do. Next slide. Okay, so we'll start off with media mentions. We had a little over 90 media mentions last year. So this is great because there's kind of different categories of promotion. There's earned media, which is where we get promotion from other entities is completely free for us. There's owned media, which is the platforms that we own, for example, our website that we control fully, as opposed to, say, like social media where we have to pay or we're subject to the algorithms, that kind of thing. And then paid media, which is where we would buy ads or something like that. So as much of this earned media as we can get for free 99 is great for us. So we had 90 plus media mentions, a combination of local, regional, and national news outlets. We even had some international interest last year. News agency, they're basically like the Associated Press, but out of France. And they reached out. And then for comparison, I started in May 2023, and that's when I started tracking, and we had 54 mentions for kind of the second half of that year. So just so you know, is 90 a lot or a little or whatever, it's kind of on track with the prior year. Next slide, please. This is a sampling of the local and regional media outlets. I'm sure many of them are familiar to you guys, kind of a cross-section of bigger ones and then little newspapers. The Owyhee Avalanche always shows us so much love. John over there is so good about covering what we do. KTVB is also one that likes to come out. And then this year, I'll draw your attention to La Grande, which is one of the Spanish radio stations in the area. And so I just love that we're also trying to receive that bilingual coverage, since a lot of, especially in the clinic, a lot of folks that we serve are Hispanics. So we might as well get that coverage from them. And so one of the things was I went on their morning drive time radio talk show and talked about syphilis. And so that was kind of a live experience, and I was happy to do that. So it's great not just get the English language. Next slide. Here's our national and international media outlets, some heavy hitters on there, some household names that we had, and then AFP, this was that agency out of Europe that I mentioned. So we had some national press coverage as well, which is great. Next slide. I won't go through all the headlines, but these are kind of some top ones that were significant. They kind of go in chronological order. Starting last January, we had the Youth Crisis Center open in their temporary location, which is really neat because now fast forward a year and the Youth Crisis Center just opened in their permanent location. But I'll talk about that next year, I guess. We had our kind of typical legislative stuff that were in the news during the legislative session, partnerships with the Marsing School District, Caldwell School District that came over here, some of their students for some training. Whooping cough has been in the news quite a bit because we had an uptick this year. Next slide. Just in school, especially like as schools started and stuff like that, it surged again. Syphilis was another one of those diseases that has been in the news a little bit more last year. Our fentanyl awareness town hall event is really successful. We hosted a second one of those for the community. The cooling centers, we had that heat wave this summer and we decided to open up as a cooling center, and we were one of the few in Canyon County. I think it was maybe like the Nampa Library and maybe one other place or something. So that was great that we did that. Some usual suspects: West Nile, algae blooms in the in different bodies of water. The groundbreaking for the Owyhee County Fitness Court, that was a really neat one, and I'm looking forward to when that project is complete. If you're not familiar with it, it's an outdoor fitness court, state-of-the-art, it's free, it's adaptable for all ages, skill levels, abilities, and so that would be really cool when that opens up. And then the big one was y'all's decision in October related to the COVID vaccination, and that's what generated a lot of that, particularly the national media interest in that. Oh, and then I wanted to mention that we do a fair amount of press releases that are joint press releases. They could be with Central District Health, with St. Luke's, Windsor Memorial, that kind of thing. So it's not always just coming from us, but we do collaborate with other local partners on press releases.
Good
Next
question.
slide. Yes.
Those press releases, do those go, like, we have a constituent services director, do those go to our guy? So they can be disseminated out? through-
I send it to other PIOs, but you said a constituent
Yeah,
services
Aaron
director?
Williams.
Okay, I don't
We
think
sent,
he's on
Joe
my list.
Decker, he's now in the sheriff's
Oh, yeah,
office.
Joe, yeah.
He's the PIO for the sheriff's office,
Correct.
and then we have Aaron Williams, who's for the
I don't
rest.
think he's on my list.
Okay.
Constituent Services Director. Okay, I'll make sure he gets those. You bet. Okay, our e-newsletter, this was something that we launched last year in a big way. We've been doing e-newsletters, but they were only going out to about 200 people, mostly partners and that kind of thing. And we have an email list from our environmental health department, our division, where it's folks that are restaurant owners that we've inspected, daycare centers, homeowners, all that. And we had about 11,000, actually we had like almost 15,000 customers. And so I took that email list and I put them all on our newsletter to get that blast to cross promote. And so it's an opt-out situation. And we had, I guess, maybe 3,000 all told eventually opt out. So we're at about 11,000 now, but it has stayed pretty steady at 11,000. So we've branched out our communications to existing customers and then able to cross promote. Hey, if you've had your septic inspected, hey, we also have, did you know we have a smoking cessation program, or we have a clinic that we could see you this week, or whatever it is. And then our open rate hovers anywhere between 35% and 45%. So that's pretty darn good
It's unreal.
for an unsolicited email blast. Okay, so I send it out to 11,000 people, about
Oh, right.
3,000, 4,000
Somebody
actually.
opens it, right.
Yes, not always this, the same, but on average, yeah, industry average, if you can do 37%, you're cooking with gas. Especially this, where it was totally unsolicited, they did not sign up for this. I'm really happy with that. And we get pretty good click-through rates. We usually do about 3 topics a month. You guys should all be on the list, so let me know if you're not receiving that. And then this was a good example. Nikki was like, hey, right before the fall, let's talk about this. That one got a pretty high click-through rate. People were very interested in that. So we try to make them topics that are relevant and timely and that sort of thing. And then people can just opt out. They can opt in on our website for free. Working on getting the clinic and WIC patients and clients. Because of HIPAA and PHI and all that, I can't just pull those email addresses. So we're promoting for them to opt in, and then quarterly, we're going to be adding those email addresses in, because that's also more thousands of people that we might as well cross-promote with them. So all kinds of topics on this. That's kind of that. And then our last slide. Okay, so then putting my PIO hat on, so this is where I work with our FEPR team, our emergency preparedness team. So I'm part of that. We had this conference in the fall where we invited other emergency personnel from our district, other PIOs. We had City of Nampa PIO, Fire Department PIO, and just kind of talking about any gaps in our communications or other emergency services and just touching base with them. So we're not all just working in silos. So that was a successful event. I'm part of the Treasure Valley Communicators Work Group. We meet quarterly, so this is PIOs such as myself all over the Treasure Valley in this area. I meet with the PIOs of Department of Health and Welfare and the other 6 health districts monthly. And we chat and kind of put our heads together and what are you doing, what are we doing, what's affecting you. And then the last thing is through the Idaho Office of Emergency Management, through the state, they have a peer team So it's like an emergency response. So if we have a statewide issue or even a hyper-local issue, but it's a big situation, then we can all jump in and help in that way. And then, and I believe that's mandatory. And that is quarterly as well, that we meet and cover different topics. So, and then the last thing is I'm working on our crisis communications plan, revamping it. We have one, it's big, it's robust, it's been added onto a lot over the years. But I want to revamp it because I feel that it's not super user-friendly because it is so beefy. So I want to just kind of reshape it. So that's a project that we're working on this year because I want that to be really quick and easy to use in an emergency situation. That's what I got. Questions, comments? Okay.
I just want to thank you for all your assistance.
Yeah, you bet.
Appreciate all your assistance with all the media reaching out. I really appreciate it. Thank you for helping me out on that.
Yeah, my pleasure. And I appreciate all y'all's flexibility when the media calls and they have deadlines and all that. So I know it can be kind of a drop everything situation. So, okay. All right. Have a good rest of your meeting.
Thank you. Thank you, Minnie. We can move on or we can take a break, whichever board wishes to do.
Dr. Brittany is right here. I think she's ready to proceed if you are.
Okay.
Yes, I'm ready.
Let's move forward.
Okay. You decided to move forward, correct, Chair? Okay.
Go ahead.
Okay. Well, thank you, Mr. Chair. Good morning, members of the board. I'm Dr. Anna Briggs, and I am the Principal Research Analyst here at Southwest District Health. And today we'll be going over some data on childhood morbidity and mortality. Next slide, please. So, childhood mortality or death and morbidity or illness are the things we'll be focusing on today. The Department of Health and Welfare has this wildly important goal to decrease the number of kids in foster care. And so to support them, our district has decided to support them and see what we can do in terms of our services to help reduce the number of kids in foster care. And so today's focus is going to be on a comprehensive view of the health of children within our district. So a couple things to note. All of these data are external data, so I tried my best to get the same time frames. My goal was to get the last 5 years worth of data, but because I was working with outside agencies, it was hard to get the same time frames. They won't line up exactly. And then the other thing is we're going to go through a lot of topics, but I'm going to walk you through it, and we are hopefully going to do this smoothly. Next slide. So the topics I'll be talking through are mortality or death, violent crimes data, childhood cancers, infectious diseases, substance use, bullying, and risk behaviors through a survey. And my last slide will be on some foster care data that we recently acquired. Next slide. So focusing on childhood mortality or death rates and leading causes of death within our district. The next thing, next slide, please. So this chart is showing childhood mortality rates. I have them broken down by different age groups. So infants are less than 1, children 1 to 9, children 10 to 14, and teens ages 15 to 18. I have some Idaho data represented in the true blue color, and then our district data represented in the aqua blue color. And overall, the trends seem to be following, for the district, following what's happening in the state, with the one exception being in teens from 2018 to 2020, this does look to be higher. When I investigated the causes of death in here, it was a difference of 7 deaths for that 3-year span. So these are in 3-year spans. So a difference of 7 deaths, and they were kind of spread throughout. So there weren't really any like trends or anything that spoke to why that happened within that 3-year increment versus the 2021 to 2023 increment. So generally we see that as kids get older, the mortality rates increase over time. Next slide. In looking at the leading causes of childhood death, I just wanted to highlight a few of these. You have these slides so you can see these, but in infants, the leading cause of death are congenital malformations. In children ages 1 to 9, the leading cause of death are accidents or unintentional injury. In children ages 10 to 14, the leading cause of death is intentional harm or suicide, and this was sort of surprising to me for this age range. And then in teens, it's accidents or unintentional injury with intentional injury or self-harm following closely behind. And then I also want to note, I have the total deaths here. This is for 2021 to 2023. I have the total deaths here. They're not going to add up because when we have fewer than 5 cases of something, we hide those numbers to protect the identity of those individuals. And so
That's just for our district.
this is just our district,
Okay.
yeah, not for the whole state. So yeah, these are leading causes of death in our children. Next slide. I also pulled some violent crimes data from the Get Healthy Idaho website. They had this dashboard that I was able to play with, looking at different ages, looking at gender, looking at different regions, and you can compare and see how this looks. But I think these data support the previous slide. They list 4 manners of death for these violent crime data. So accidental firearm, homicide, suicide, and then undetermined. I'm not sure what this means. But we see that suicide is impacting kids of all ages. Now these are bigger ranges, so like, take that as you will. We see suicide is impacting our kids, both males and females, and sort of throughout this 5-year spread that I pulled. And I don't have the counts on these because they were all fewer than 5. And so reporting that was not anything significant. Next slide, please.
So,
Oh, mhm.
can you go back? Those bars on the left, the one says 4, I think. Is there a bar there that's not showing in 2018?
6, it says. And yeah, I'm not sure why that bar isn't showing.
And those other numbers are only suicides?
This is,
2020, 21, 22, are those all suicides? Or the other numbers
Yeah,
show
this
the
was just-
totals or something?
right, this was just a screenshot to kind of show what the dashboard looked like.
Okay.
If you wanted to go and like
Explore,
play,
okay.
yeah, explore, yeah, to show that it was there. Although I'm not sure that this will be available much longer. I'm not sure how that's being maintained, but this is where I was able to pull the data.
What's the 2019 number on that bar?
It's less than 5, so there is no actual number. Any other questions? Okay, next slide, please. So to sort of summarize the childhood mortality data, we see that rates increase with age groups. D3 rates appear to follow the same trends as Idaho, with that exception in 2018 to 2020 in our teens. And I'm sorry, there's a typo on your slide, so it is the 2018 to 2020. And then accidents or unintentional injury are a leading cause of death for children of all age groups. And intentional self-harm is a leading cause of death in children ages 10 to 18, with that Get Healthy data saying all ages, but that's because those bins are so large. Okay, next slide, please. So we're switching gears here a little bit. I'm going to talk about childhood cancers. Next slide.
Just real quick on the death mortality rates. Is there a way to suss out suicide rates by age group over time anywhere?
I don't have those data. We just have like the counts. For our district, it was broken down like for the count, so we can see.
We kind of broke it down over all deaths, but it would be helpful or useful to have, in particular, accidental suicide, have that broken out. So you have the groups here, but it doesn't really show the actual rates of personal firearm, homicide, suicide.
And that's because all of those cases were fewer than 5, and so I couldn't report those actual numbers.
Right?
Mm-hmm.
Okay, probably not going to be too useful.
Right, yeah.
All right, fair enough.
Okay. So these data are from a report that was generated by the Idaho Cancer Registry. And this is a 10-year spread. So like I said, I tried to get 5 years, but I got a 10-year spread. So from 2012 to 2021, and they consider childhood cancers anyone under the age of 20. And so for this 10-year spread, and these are Idaho data, not district data, there were 981 total diagnosed cases of childhood cancers. Of those, 858 were malignant cancers, and we had 118 children die from some form of cancer, with leading causes being brain or central nervous system and leukemias. In working with our colleagues, they did an analysis at the district level, but determined that there were no trends detectable. That's likely due to the really small numbers that we have at the district level, and then also really high variability, which we'll see on the next slide. So this is childhood cancer mortality. These are Idaho data, but I just wanted to show you how noisy these data can look. So again, we have years over on the bottom axis, and then we have mortality per 1 million is how they scaled it up so that we could compare the US data to Idaho data. And you see the Idaho data is really noisy, but when we scale up our data up to 1 million, that's so much more than we can have here in Idaho. And so it makes our data look really noisy and messy, and it's really hard to detect trends when we scale up to that size. So in their analysis, they determined that over time, there were no changes in cancer mortality over this 10-year spread. There was a slight bump in 2019, but it wasn't significant in their analysis. And then also in their analysis, Idaho ranked 43rd among states for pediatric cancer deaths. In a good way, we had a lower cancer death rate. Okay, next slide. So to sort of summarize that, Idaho ranked 43rd with low death rates for childhood cancer. There were no statistical changes in Idaho childhood cancer deaths or rates from 2012 to 2021, and there were no detectable cancer trends for our district within this time period either. Next slide. Now we're going to look at childhood infectious diseases. Next slide. So I wanted to show you all of the diseases, infectious diseases that are impacting our kids for a 5-year spread. So it does say 2019 to 2025. We're barely in February, and these data were pulled on January 7th. So it's just 1 week of data so that we can see some of the places where we're continuing to have like outbreaks, which I'll talk about on the next slide. But I wanted to highlight sexually transmitted infections. And I'm highlighting this because there was a study that nationwide STIs are going down, they're decreasing. So we were curious, is this happening in our district, and is this happening in our kids too? I also have some gastrointestinal diseases of interest in purple, just to kind of show some trends there, and then respiratory diseases of interest. So on the next slide, we'll look at these over time. Next slide. Oh, sorry, back one. Thank you. So in blue, we have the respiratory diseases of interest, and we had a couple press releases on these too. And so I wanted to show why we had those. So in 2019 and 2020, we had 64 cases of pertussis, so pretty low numbers, and then pretty much nothing until 2024, and we had a big spike. And so we would consider this an outbreak, and that's why we had a press release to inform people that pertussis cases were increasing. And then I think we also had a press release on respiratory syncytial virus. This is a seasonal virus, so it does happen usually in the late fall to winter season. And I just wanted to show that the number of cases kind of fluctuates year to year, but this is something that happens seasonally where we don't see a lot in other seasons, but then we do see large increases. And then
on the RSV, are you able to block it out by age or divide it?
I could, yeah, I do think that's something that we're able to do with our data. I did
just
not.
Anecdotally, you know, what I see clinically is an increase in number of adults coming down with RSV, whereas, you know, in previous decades, I would say that, you know, it was really a childhood disease. But I'm seeing much more severe cases in adults more recently.
Adults of
just
what age?
anecdotally.
Yeah, curious, what adults of what age do you see that in?
All ages. I mean,
Okay.
I would say mostly middle age, you know, 40s, 50s. I admitted a kid the other day, 45-year-old. Um,
I love that.
You're not bad.
Sounds great to me.
See, I'm still a kid, so. So, yeah, I'm just curious if maybe we could have a look at the actual age stratification on those.
Yeah, I'm sure we could pull those data.
Cool.
Yeah.
Thank you.
I'm gonna make a note of that so I don't forget. Okay. And then I also wanted to point out gastrointestinal diseases. So these, we do see cases sort of throughout the years. And when we see something, again, that's a little bit different, that's when we consider an outbreak. So in 2021, there was an outbreak of Giardia and also an outbreak of norovirus. And I also wanted to highlight these because nationally there was a news release on an outbreak of norovirus nationwide. So I wanted to see what this looked like for our district, and at the district level, it doesn't look like there were really that many more than usual, but maybe. So that could be something we track. So it was impacting the nation, but not necessarily in our district, or at least it wasn't reported. And one thing that I'll say in talking to our epidemiologists is that a lot of these cases go underreported. If you get a stomach bug and you're able to like resolve it at home, you're not going to go into the doctor and it's not going to be reported. So yeah, so I just wanted to also highlight those. But yeah, we see over time, you know, we do see cases here and there of those different ones. So next slide. Now this is the sexually transmitted infection diseases. And the two most common ones that we see in kids ages 0 to 18 are gonorrhea and chlamydia. And so I wanted to plot these over time to kind of detect the trends. I didn't run statistical analysis because I didn't feel confident in the analysis because there are just too few cases at the district level. But generally we can see that it looks like the number of cases being reported is decreasing over time, at least for the last 5 years, in both chlamydia and gonorrhea. So next slide. So to summarize the infectious diseases data, we did have a pertussis outbreak at the end of 2024 into the 2025 winter season. There was a nationwide norovirus outbreak this winter, but may not have impacted us at the district level. And detection of gonorrhea and chlamydia appears to be decreasing over time, but we'll continue to monitor that. Okay, next slide. Okay, so we're gonna focus on substance use, bullying, and risk behaviors, and these data are from surveys that were conducted at the state level. So next slide. The first one is the Idaho Healthy Youth Survey State Report for 2021. You'll notice this is a little outdated, but these are the most current data that we have. So 54 schools participated in this, and they surveyed 6th, 8th, 10th, and 12th grade students. They had just over 9,000 valid surveys. And I would have loved to have just gotten our district's data, but they lumped the West all together. So this is District 3 and District 4 data combined. Okay, next slide. So in 2021, youth in Western Idaho reported that there were 34% of them that reported that they had had at least one drink of alcohol in their lifetime. 13% reported having used marijuana once again. 10% reported having misused prescription drugs. 18% reported having used a vape pen or e-cigarettes. And less than 1% have reported using methamphetamines. So substance use does appear to be something that is used by kids in our Western hub, so in the Treasure Valley. Next slide. I also want to point out, these are huge surveys. They asked a lot of questions and there are a lot of good data. I just pulled out the little pieces that I thought might be of interest to you all. So if you're interested in learning more, I encourage you to go through the survey. It's available online.
And this is all under 18?
Yeah.
So it's not broken up by age at all?
Right, yep. Yeah, just the 6th, 8th, 10th, and 12th grade students. And so then they also asked some questions around suicide ideation and attempt. So in this chart along the bottom, we have percentage, and then the questions increase in severity as we go up. And I have Idaho data, and then that West Hub data in the aqua blue color. And so I also had it over time because I wanted to see if we could detect trends. Again, I don't have the raw data, so I can't conclude strong statistical analyses from this, but it does look like there is an increase from 2019 to 2021 in our district for kids who have seriously considered suicide. But this trend also follows what's happening at the state level. If we move up to the next question, have you made a plan about how you would attempt suicide? We see that there was an increase in 2019, but it stayed pretty similar in 2021 for the district, but there was an increase at the state level, so not necessarily at the district level, but there was at the state level. And then when asked, have you attempted suicide, we did see an increase in 2019, and it kind of stayed the same or maybe dipped down a little bit for our district or for the Western Hub, but has been steadily increasing at the state level. So seems that suicide and mental health are still issues we could focus on for our youth as well.
Was this from the same survey?
This is the same survey. Yeah, they asked a lot of questions. Next slide. The next two bullet points are on bullying. So about 20.6% of kids in the Western Hub reporting having been bullied in the last year. And that's just a little bit lower than the 24.6% of youth in the state reported having been bullied. Next slide. There's also this other survey, the Idaho Youth Risk Behavior Survey, that asked a lot of similar questions. This is at the state level. They didn't break it down by region, so these are all state data. There are 990 students in the data we're about to look at over 23 public and charter schools.
And this survey has only been done since, when the earliest date was 2017 or 18? When did this survey start being done, do you know?
I don't know. Do you know, Nikki?
You mean how long has it been done, like past years?
Yeah.
I would guess a few decades.
Oh, really?
Yeah. This was the one that is, I think, no longer done in the state, the legislature. So
Like the last year, I think.
participating. I think it's been a few years actually.
Remember looking at
I
it.
think this is the, yeah. I think
This is the
last
last survey that was conducted. Yeah. Okay. So next slide, please. So they also asked questions about substance use. So in 2021, 19% said they were offered, sold, or given illegal drugs on school property. That was a bit shocking to me. 1 in 5 kids had been offered illegal drugs on school property.
That was going on when I was in school.
Okay.
It hasn't changed.
38.5 had used e-cigarettes or electronic vapor products. 23.3% reported having used alcohol in the last 30 days. So the way they distinguish this, when they say in the last 30 days, to them that means it's like a current user or like an active user. And 14.4% had used marijuana in the last 30 days. 13.9 had ever taken prescription drugs without a physician's prescription. So again, these data are also saying that substance use is of concern in our youth. Next slide. The next set of questions were on healthy behaviors, more on health management. So 43.2 reported that they were trying to lose weight, while only 24.1% of them reporting actually being overweight or obese. And as far as eating healthily or
Is that self-reported? Sorry.
Self-reported,
Okay.
yeah. As far as nutrition, 10.3% said that they drank a soda once or more per day in the last week. Only 17.8% are eating or drinking the recommended fruit servings per day in the last week when they took this survey, and only 10% are eating the recommended vegetable servings. So could be doing better on our fruits and vegetables. And then as far as physical activity, 67% said that they spent 3 or more hours per day on screen time outside of school, so cell phones, tablets, television. And 49% reported being active for at least 60 minutes in 5 of the past 7 days of the week. So
Pretty good.
yeah, about half. You think it's high?
It's PE.
Yeah.
PE.
It might be their PE class.
That counts.
Counting the finger movement.
Okay, Next slide, please. They also asked questions on sexual activity. So 30.7% reported that they had had sexual intercourse, while 20.7% are currently sexually active. And I was a bit surprised, 17.7% report using substances before having sex, so combining the two. And I think it would be valuable to have these data looking at our STI information for more current data. So yeah, that's just a little side note. Next question, or next slide, please. So to sort of summarize that, substance use, mental health, bullying, sexual activity, nutrition, and exercise are all things that are still impacting our kids in the state and within the Southwest region of Idaho. And there have been attempts to continue to collect data like these, but there has been a lack of support. And I think these data provide valuable insight on the factors impacting kids' health. So hopefully we can increase participation in surveys to understand what's impacting them.
And the reason they discontinued that survey wasn't because of the power of suggestion they were concerned about?
Yeah, I think that is some of the language around like gender identity and things like that that had been added to the survey at the federal level. I remember correctly.
What actions were being taken based on the survey results?
I think it helps us understand what's happening in our youth to get a better perspective, and it's their perspective too. So what's happening to them? Like for example, the STI data, understanding how many are actually sexually active and seeing if it compares to those STI data that we're seeing, or if they're going in opposite directions.
Yeah, often your data from a survey is only as good as the survey itself, who put it together and who's interpreting it. So you need to be judicious and careful about making policy decisions based on surveys. I think that's probably what's some of the concern.
They did have pretty rigorous, they described their methods ahead of time in all of these surveys, and they had rigorous, like, there were a lot more kids who actually took the surveys than were counted in the surveys. They had questions built in to see if like they changed their answers, and if answers weren't consistent, they would kick out that survey for not being valid. So they did have measures to make sure that if there was something funky, they wouldn't use that survey to review their data.
But this is a federal survey, so is that what you say?
It was, my understanding is it's a national survey that is executed at the state level, and then the data are reported out, because there's also an adult version of this survey called the Behavioral Risk Factor, Behavioral Risk Factor Survey, I think.
Yeah.
And then, is that in the two districts?
This was a statewide.
The risk one is a statewide survey, so just the whole state altogether.
9,000 students.
There were 900 in that one, and the Healthy Youth Survey was the 9,000. And that one was broken down by region, so.
I just, yeah. Concerns with low amounts of participation compared to population. Really, all it takes is a couple to really skew those numbers.
You also have to realize most of the questions are subjective too.
Well, my biggest issue is, you have over a million, about 1.3 million population in the state. How many of those, then you have all the youth that are part of that. You have a small number. All it takes is all it takes is a couple of those small numbers to really adversely affect the overall. For me, the larger the numbers that participate are much more accurate, generally speaking.
Yeah, absolutely. If we do increase our numbers, accuracy does increase. But I do think that they try to build into these surveys understanding for scalability too, so, yeah.
Do you know any actions or policies that have been put into place or based on the results?
I don't, and I should have looked that up, I'm sorry.
Well, no, I mean, it's good to have the information and whatnot, but at some level, it feels like an exercise in futility if we just gather all the information and then don't do anything based upon it.
I mean, yeah.
I think some of the behavioral health data has been driving investments in like the governor's Idaho Behavioral Health Council, funding for like youth crisis centers and youth assessment centers. I mean, I can't tell you that they use that data to make those decisions, but my guess is that, yeah.
I guess that's my question. What's the goal of the survey? Is it get more federal grants for specific things or?
I mean, the data can help us choose priorities, right?
That's what I don't think it's so
And
much.
invest in
Resources.
resources.
It's just knowing where we're at, health-wise.
There would be a lot of differences between schools. So I guess if you want to apply for grants, based on some of this stuff, are you applying for grants for what school?
Mhm.
And which one? I mean, because it's not the same, not even close. So,
Yeah, I agree. And I think that some of why they lump together data though is to protect individuals and schools. And so I think they try to just provide the comprehensive view so we can understand what's happening in the region. But yeah, it would be great to know school level, but I think that could also be sort of telling, you know? So
we want
have to
data, but
protect
we
personal
want data, but we really don't want data. So were parents alerted and the children had their parents' permission to take this survey?
Well, this was prior to the requirement for parental permission to,
Okay.
yeah, so I'm not sure about that, but this is prior to that law being passed. Okay, any other questions on this, comments?
I have a question, actually, going back to the childhood cancer rates. I don't believe that.
Yeah.
We hear a lot in the news that cancers in the young population, I think that population is under 20 maybe, or under 18, that cancer rates in young people are going up. But in that graph,
Yeah, so that was cancer mortality, so cancer death rates.
yeah, there's a line graph there.
Mhm.
Just wondering if that, it looks to me at least like the line, that one, that pink line, it's pretty flat, but maybe trending down overall. In the last few years, it's kind of flat or going up, and I'm just wondering if this is the data they're looking at, or is it a different older population that reflects? Or is that something really just looking at those last few years, whereas if you go back further, the overall rate is still going down?
Yeah, well, so they've concluded that there weren't any like statistical differences, so there weren't any trends that they could detect. And I think with like most data, if you do just pick like
That's what I'm
the 3
wondering.
years that you want, and you're gonna see a trend.
That's what I'm asking,
And
is
so I
that,
think that's why they wanted to look at it over a 10-year span to
Right.
see is like over time, are we really seeing increases or decreases? The other thing to note about these data is cancer data are usually lagging a little bit to collect the data, clean it, make sure that it's accurate. And so that is one thing they told me to like let you all know that it is usually delayed a little bit. So they can make sure it's clean, good data. But yeah, I mean, I think it's better to look at a spread with a bigger chunk of time so that you can really determine if there are trends.
Yeah.
Yeah, and these are under 20, so anyone under 20.
Yeah, and if I might add to that, with this trend line looking relatively flat, but then what you hear in the news was like, it went from 22 to 24. Well, okay, that's a 10% increase over 2 years, right? That's kind of and it may be a short-term trend, so that may not play out long-term. So it's just kind of the things with statistics.
exactly, that's
Right.
what.
You can look at it as the farther out you look, the less, concerning it may be, or vice versa. But
Yeah. That's exactly what I was getting at.
Yeah.
We do hear a lot, it's very
But
alarming,
what-
that it's gone up 20%.
As you look at it, like over time, it's been, for the most part, all slightly decreasing over time, and then over the last 4 years, we've seen a slight increase. So I think that's where you're seeing
But you could have said the same thing almost from 2014 to 2016. It looks like it was trending up too, so.
Yeah, you had like a one on 2015 and 2016.
Yeah. I mean, and also remember, these are really scaled up to get up to that like rate of per 1 million. And so when you look at it at that level, we only had 900 cases total in a 10-year span. So to like scale it up to 1 million is just, it's noise.
Right.
Yeah, our local data is not very.
Yeah. Did that answer your question? Okay. And so then the last section is on foster care. Next slide. So we have been looking into what does foster care data look like for the districts, that we can see how we can help towards that mission of reducing foster care kids in the foster care system. And so one of the things we looked at was the top reasons for removal from their home. And so these are the top 5 reasons for removal within the district. They are neglect, and not in any particular order either. Neglect, caretaker substance use, physical abuse, incarceration of the caretaker, and an unstable home environment. And we got these data also at the county level, and looking at the counties, these are the same 5 causes throughout the county. So it's not like one county is contributing more or anything. These are the top 5 reasons for all of the counties, but these were the top 5 for the whole district.
What's the criteria for unstable home environment?
It's a good question. I'm not sure the definitions, and that's one of the things that as we continue to work with the department to collect these data, we're going to try to understand what their definitions are so that we know how we might be able to step in and help.
Okay, because that's, again,
Subjective.
very subjective.
Yeah.
The incarceration is pretty close, or easy to do. The physical abuse is very easy. If your caretaker's on drugs or alcohol, half the time not mentally there, that's easy. Neglect, that's a little bit more subjective, but it can be done. If they're not getting to school, and they're not getting medical attention when they need it. That's all. But the unstable home environment, I think we need a lot more clarification on that one.
Yeah, and oftentimes it's not just one reason too that kids are removed.
I'm
There
sure
are
there's
multiple
many,
reasons, so it could be a combination of this plus others. But we haven't been able to get those data on, and I think those are kind of protected data too. So
I'm sure.
we are working through how to, work with the data and get it in a way that we can use it, but also protect the identity of those individuals. Okay. And that's it for my presentation. I'm curious if there were any data that you expected me to cover, if there was anything you thought was missing in this overview.
Well, for me,
Sexual abuse. Just threw that out there.
As one of the reasons for removal.
Didn't mean to interrupt you. Yeah.
Yeah, that is also present. I did see that in all of the counties, but it was just a lower number of kids being.
You mean for the foster care data, or in general?
In general.
Oh, in general, okay.
my thing is for here in Idaho, when we do national compared to the state, so low numbers to actually go by. And just like you see on the cancer, mortality, you see great big spikes. Well, it's because there's not very many people that are involved. In a 10-year span. We had less than
1,000, yeah.
Yeah, 1,000. So,
Yeah.
And then also with the medication that they have today, the life expectancy is much greater than it was 30, 20, 30, 40 years ago. So, with a lot of that, the biggest thing is just the low numbers. And I don't know how we fix it. For us to make, health decisions, it's kind of difficult because the numbers aren't really there. Now, there are some health things that we can seriously look at. are really affecting our citizenry right now. So anyway, thank you. I appreciate the data. It's just that, again, we're have such a low population. It's really hard to have really good, solid data. It's not your fault. It's just the way it is. So anyway, thank you so much.
I have a question about foster care. Is the health and welfare, is their goal of reducing the kids in foster care? Do they have a way they're going to achieve that? Do you make it more difficult to remove kids in these situations? Do you have any idea, Nikki, what they're?
I think I've heard of some policy changes, and I'm kind of looking at Don because he came from that world, and he might be able to speak to some of that more than I could. But I think also trying to build some prevention strategies. Like I know the director really is supportive of the public health districts doing the home visiting programs.
Like addressing the root causes.
Yes, exactly. Yeah, and like WIC with providing like healthy nutrition and nutrition education to at-risk families. So some of that's prevention focused, but I think some of it's also policy related.
Yeah, I think I've been out of that space for about a year, but I think there was a Supreme Court ruling that changed kind of the standard on one of the reasons for removal to, I think there was a concern that there was some subjectivity in that space. And so they kind of changed that definition a bit. So that will influence the entry rates in foster care.
Because you want, I mean, obviously you want it to be a last resort to take the kid out of his home, but you also don't want to leave a kid in a home that has had sexual abuse or something. So if they're going to achieve their goal, reducing the number of kids in foster care by leaving them there, that's not so great either.
Well, they weren't good in Airbnbs either by themselves, and that's what that was going on.
Yeah, well, they're not that great in their homes in Payette where they're wandering in and out either, in the foster care facility. So there are a lot of problems, so.
Well, statistically, we know that if we can keep the child in their home with their family, their success rate is tremendously higher than if we put them in foster care.
Right.
So I think the idea is to figure out what we can do to keep them in homes, in their home, rather than getting them in foster care. I totally agree with that, whether sometimes it might be a grandparent or whatever, but sometimes that, that's not foster care, that's just, that's keeping it in the family. So
I think they are trying to increase that too,
Yeah.
find a family.
I actually know the former director for Area 3 Senior Services, the grandpa, got his grandkids staying with him because of that issue. But it's a lot better for those kids to be there than they are in a foster home. So
You hear about that a lot more.
I'm not a big, I understand that there's a need for foster home, but I'm not. Taking a child away from their family is not the best thing, I don't believe.
No, I agree. And I also know some foster families that get kids from out of state. So are these Idaho kids in foster care that they're addressing or that they want to address, or how much?
That's what the director is addressing, yeah.
Yeah,
Right, in terms of these data, they're removals from
from Idaho homes.
From our district.
Yeah.
Commissioner, the goal is to place children with family. If there are family members in the area, then they're reached out to and solicited to see if they can take that placement. Sometimes they have an aunt or uncle or grandma living in an adjacent state, and so they would reach out that ring further out and place in another state just to maintain a connection with family in that
Right.
situation.
I guess what I'm saying is if they're looking at statistics of the number of kids in foster homes in Idaho, some of those kids are probably coming from out of state. Or am I wrong about that?
Those kids placed from out of state would be the sending state's responsibility.
So those would not be reflected in Idaho number of kids in foster care. Okay. That's what I was asking.
Okay, thank you so much.
Yeah.
Really appreciate it.
Thank you.
Hey, at this time, I think we should probably take a break. For the good of the, for the good of the board. Joan Jack.
Oh, really? It's gonna be.
Are we ready?
Yeah.
We're back on? Okay.
Mr. Chairman, the update for the food establishment license fees is that last week, myself and Representative Cornell Razor met with Health and Welfare, House Health and Welfare Chairman John Vanderwaty to try and get this thing even a print hearing. Because right now it's an RS and a print hearing. The bill sponsor goes before the committee, says, here's what it is. They have a little banter sometimes, question and answer time, and then typically the committee will vote to print it, and then that's when it gets its actual House bill or Senate bill number, and then the whole world can see it. Before then, an RS is like a privileged document just to the representative or the senator. If they give it out, that's one thing, but if anybody on the committee gets a copy of it, which they get, so they can review it before, but they're not allowed to share it with anyone else. So that's one of the important parts about having an RS hearing, a print hearing, so the whole world can see it. So we met with the chairman last week. He had some questions. The director and staff and whoever else that you're working with have been extremely responsive and great with the answers and the information, you know, to basically counteract. But in that meeting, the chairman just kind of, I'll try to keep this positive spin on my viewpoint of the legislature, but his concern is this, in my opinion, ill-founded concern that if we are allowed to set the fees, then the budget's just going to explode because that's one less mechanism of oversight that the legislature has. And I'm like, Chairman, there are a lot of fees that we set that you have no clue about and you have no oversight over. So like, we're already doing this. Oh, okay. And then he'll talk a little bit more and I'll have something else to come back like, Mr. Chairman, actually, that's not the way it is. You know, with House Bill 316, the state further distanced itself from the health districts. So actually, what you're trying to turn into an argument for not doing this is an argument in my camp that we should. You guys have said that you don't want to fund this. So how about you help us at the local level not force our property taxpayers to subsidize the fees for this, and it's a win-win. Well, what do you think these are gonna change? So that was some of the information he wanted to know. Okay, finally I got him softened up and had to answer a response for everything that he threw out there, and he just looked at me. Okay, what do you think these are gonna go to? Like, well, we collect roughly 50% of the fee cost, so they're gonna double. Well, you're willing to say they're gonna double? Yes, and we have the data to provide it. Like, you guys haven't changed this as a legislature for so long, and tried to relay to him, that's the problem with having it in state code, is you guys don't, one of you will look at this every decade, maybe, and it's not a priority because it's not this big, you know, umpteen $1 million shiny object out here that you want to campaign on next year. He got a good chuckle out of that. But anyway, so he asked, what do you think the fees are going to be? And then give me what the methodology is for how you look at these and how you're going to determine what the fee is. So Nikki got us that information. Representative Razor was supposed to give it to him yesterday, and then I'll give him about 24 hours and then I'll start being a pest again because the legislature is going to want to get out of there in a little over a month. So if nothing else, I'm going to, like, normally it's not this hard to get a print hearing. Normally it's like trying to get a hearing in the actual committee to move it onto the full body. So if we go another week or so, I'm just going to really push him to at least get the thing printed so we can have the discussion and it can get out there, and then try to educate everybody who can over the next 9 months before the legislature session in 2026, and maybe we can get some movement on it. But that's kind of where it's at. I mean,
You're getting kickback from the groceries Albertsons, Fred Meyer's and that yet?
And no, and I don't know if he hasn't said anything. I don't know if it hasn't even been printed yet for them to
Okay.
really see that unless somebody starts talking, hey, this is coming kind of thing. And so that's one thing I want to get, like, hey, let's get it out there so they can see what we're trying to do, but
I'm sure their lobbyists are looking at it.
the biggest fee listed in there is like $250. I mean, you have to double. I mean, I used to own a Papa Murphy's. We used to have health inspection at least once a year. I don't remember what the cost was, but I mean, if it was $100 and went to 200, okay, I got to sell 10 more pizzas, to make up for that kind of thing.
Yeah, we had a bowling alley in Homedale and it was a minimal fee.
Yeah.
We never even worried about it.
Well, and across the state, the numbers that have been provided that have passed on, we're subsidizing as a state taxpayer about, what, $2.3 million for collecting 2.1, I thought?
Maybe.
Yeah.
What I'm
So, I mean, it's pretty consistently roughly 50% that we need to collect in addition to what we're collecting right now, and
Just to break even.
just to break even. And I had to explain to him, it's like, if you don't deal in this every day, by and large, the legislature does not understand what we do as counties. Like, that's putting it nicely. They don't have a freaking clue what we do as a commissioner and the rules that we have to apply, like we live under. So I had to explain that to him, like, I think it's the third line of the bill says, we will reasonably cover the cost when we set the fee. It's like, that's what we do at the county level for all of the fees. Like, you don't have a problem with us doing it there, and there are way more fees than just at the health district, so.
Watch out.
Just let us do our thing. We're already bound by state law that we can't go out there and then and just raise it to whatever. Cause he was thinking we were gonna raise this fee and now we're gonna include all this other stuff, that's going on here and try to pay for that in the health inspection fee. And I'm like, no, we already have other fees for that you don't have any control over. We cover it there. It's like,
We can't charge more than it costs anyway.
and that's what I kept relaying to him, and Cornell is good to have, even though he's a freshman. He's a former county commissioner, so that's why I wanted him to run this, because he's familiar with this. He's familiar with having to live under those rules, so he's good.
Well, I thank you for spearheading this. It's been going on since I've been on the board. We've been trying to get fees taken care of because it's always been the same thing. We're taking taxpayers' dollars to support businesses that are making money off the public, and so we're paying on both ends. I mean, because being that I was in that also, but that minor amount that it was, we used to absorb it, but if it was a larger amount, it just goes on to the customer. I mean, that's just the way everything works, because your food costs go up, you just,
But I would wager in most food establishments, the $100 over the course of a year's worth of net sales is going to be so negligible, you couldn't reasonably raise the fee to just cover that. I mean, you'd be raising prices like pennies. But also, full disclosure on the chairman he's not exactly a big fan of health districts in the first place, and I think that is really the premise for his hesitation. Is he doesn't necessarily think that the thing should exist in the first place, and if we're allowed to do our own fees on this, it's just one more mechanism to keep it alive. So I'm trying to break through with that, like, okay, in the meantime, while you're working on whatever it is you are in the existence of the health district, right now you're forcing my property taxpayers, at least in Canyon County alone, to pay over $200,000 extra that the establishment, food establishment, should be picking up the tab for. So that kind of stinks. And I'm gonna tell people that you're the guy holding it up. And, oh, okay, you know, sometimes like, they don't understand how the system is set up because they don't deal with it all the time, and so you gotta kind of push back a little bit, so. He was laughing by the end. He's gonna learn to love it, I think.
Invite him to a board meeting.
So all of the fees for the restaurant inspections, they're not the same that you're anticipating, because isn't it now like $100 an inspection? It goes up and down, okay, depending on like what it is, like from a food truck to a restaurant? Okay, that's what I wondered.
Grocery stores are different.
Right, yeah, when we talked about this, I didn't even think about grocery stores and delis and yeah.
You have to have a deli, it's a different. Everything's, you know, like your Albertsons earlier, Fred Meyer's, that they're required to have a little bit more, but not as much as you would think.
Yeah, no, I'm sure not.
It's just, I'm glad Zach's doing this, but we've been trying to get fees changed since I've been on the board. It's been an uphill battle every year.
Mm-hmm.
Thank you for doing it.
Yeah.
Appreciate it.
No, it's fun. I like banging my head against the wall. No, it's good. I mean, that's one nice thing about being in this position is it gives you some experience doing it at your current job level and be able to go to them directly when they don't. They've never been a commissioner. I think there's only like 4 or 5, maybe 6 former county commissioners in the legislature. So by and large, they have no idea what we do. So you got to educate them in part of the process. And if it makes it easier for us to do our job and it's better for the taxpayer, then it's all worth it. It's just.
Or they were a former county commissioner and they think that everybody's trying to rip off the people. So one of the leaders does that from Star. I won't say names.
Yeah.
But he's from Star.
Yeah.
So that sentiment of just wanting to eliminate the health districts altogether, what do you think his image of, would health inspections not be done in that case? Have they even thought about that?
I have no idea. I just. Like,
It will go back to the county.
Yeah.
Yeah.
Which, again, I could have this discussion with them all day long about how they statutorily tell us counties, you will do this, you will do this, you will do this. And then, oh, by the way, in the next statute, they handcuff us and shackle us on how we financially provide for that to actually take place. So just like, look, throw us a bone here. Like, you're making us do this stuff. You stopped funding us. And yet we're still coming up short. Like, help us out. So hopefully he's a little more receptive and we'll at least get it printed so we can find out who's going to freak out from industry and work our way around that.
Kind of such a small thing. It's really a small thing in the whole scheme of things. So
That's part of it. What's baffling. I mean,
yeah.
a couple $1 million and you literally could, potentially say, or campaign in their behalf that it was property tax relief, but.
There's a number of bills in the legislature. I feel like they're trying to take control away from the local.
It's funny how they work. I watched it for many years. You get on television, we want to support our locals because they're the ones closest to the people.
Yeah, but
we gotta help them out, work for them, help them do their job, do it. And then they turn around and take it all. It's just amazing. It's amazing how they are closest to the citizens. That's the best thing there is. Yeah. Next thing you know, they're taking away or not letting you, do anything to help. We can't even do any additions to our court or our courthouse and that because we don't have the funds to do it. And it hasn't changed for over 40 years now. It's the same size as it was 40 years ago.
But they take stuff away and then they give us stuff that we really don't need or want. Yeah.
Let us do it.
Yeah.
We're right now in the middle of redoing our septic system, so that's
Hopefully you can get, past the inspection for that.
It's going through DEQ. We're pretty much done. We're gonna start boring next week, no, next month. So it's, yeah, we're okay. We had to buy a property about 1.5 miles away. All expensive. Anyway, it's just amazing how the state, I'm glad you're doing it, Zach, because I lost my patience with them a long time ago. In fact, I probably offended more than one representative, so I just don't go back there. That's for me.
Well, on that note, I'll
Go ahead.
take over. This wasn't discussed in any of our executive sessions, but I do want to make everybody aware of it if they aren't already. So as you recall, just recently, they put together this ridiculous public defender thing. So it's, right now, it looks to me to be like a bit of a disaster, but the reason I point that out is because it's just been in place for a few months, and at one of our magistrate commission meetings here a while back, they talked about the guy that's running it right now, Frederickson, wants to raise his budget 136%, which I pointed out, well, now how is that saving the county's money? So now they want to take over the ambulance districts and the EMS districts, which we're having problems with them because of the statewide healthcare improvement project, which is Medicaid, Idaho's Medicaid plan. And in that plan, they have value-based pricing. So the value-based pricing makes it so that the ambulance rides are only $400. That's all they can charge is $400 a ride. So of course, nobody can do a ride for $400, especially in my area where they have to go a ways to the hospital. So now the state's trying to fix the problem that they created by shuffling it from health and welfare to FEMA so they can find more money for it and make it an essential service. So in the process of that, and I asked Kelly this, but that's not what I'm hearing, is that when they do this and it's a takeover, I don't know how they're going to do it, especially with rural districts where most of the people are volunteers, but it does eliminate our control over it. So I'm just throwing that out there just so you know. So I don't know where that bill's at right now. It's gone back and forth. So anyway, there's that. And then I don't think we have a lot. There's the way we choose our boards, and they're trying to fix that as far as, I don't know, fix it or whatever. The legislation that's coming forward is basically each county will pick their person, and the only person that actually has to be voted on is the doctor that we put on the board. So we won't have to have a voting procedure. And the only other thing I think is, well, Nikki can address the drug side of it. The health and welfare also is eliminating out of the rules public pool inspections. Apparently there are some that do public pool inspections. Brent Mendenhall made the comment last meeting, he doesn't want to get into that business, and neither do I. Most of the public pools are actually in the cities, so the cities can do that. They can, and actually the people that own the pools could take care of that. So we won't have to be in the business of public pool inspections. And the other one, let's see here, daycare licensing, that's just an update that they want to eliminate the ratios and let the providers set the policy on their ratio of child per teacher. So, and the drug one, Nikki, I'll let you explain that one, because that actually does affect the district.
Do you mean the 340B?
Yeah,
Okay.
on pricing side of it.
Yeah, we haven't, I don't think Beth and I have talked about it much, and I think it just would be adding more administrative work, because we'd have to report the amount of, I think, medications that we
Which was over 340B.
and that would have to be reported to DHW, SCO, and the AG's office annually. And we don't currently do that, so it'd just be something new. And it's not, we're talking about like antibiotics, primarily those for tuberculosis, birth control, and antivirals. So for us, we're a small player. This is going to primarily affect like federally qualified health centers and hospital systems.
Did I miss anything that was important?
Well, I was going to mention that the pools will sunset, and so that will
July 1st, so that is something that the cities do have concern about. I have a meeting with Mayor Kling coming up to visit with her about it. And I'll just bring that back to the board when we figured out what we would like to do moving forward.
So the city wants us to do it rather than just for the couple of pools that they have? I mean,
I'm not sure. I haven't met with her yet. I mean, we haven't talked yet.
Oh, okay. My
She,
apologies.
yeah, it's okay. It's coming up. I had just made her aware that, this was potentially going to happen, and we had some concern about that, and so I don't know what she's going to.
I'm sure the insurance companies are gonna be heavily involved in it, so I'm sure that they'll come up with something.
Well, yeah.
Insurance companies are the ones gonna be more, you know, if you got a public pool and you're not testing or whatever, you privately, however you do it, they're not gonna insure it, so they'll take care
It'll
of it.
take care of itself, right, exactly, that's, I think that's what kind of,
And,
that's
you
what
know,
I was
whether
thinking.
even if it's a motel or whatever, they're under the same thing. Because if something happens in that pool, they're responsible. And the insurance companies are gonna oversee that. It might end up coming back to us, but right now, the insurance companies are gonna force them to do whatever they need to do.
That was a point Director Adams made to me too. He said they're gonna be, all the pools, there's lots of pools out there, a lot more than we ever would have inspected or but those guys take care of their own, so I mean, and if there's something wrong with your pool and you call somebody to come inspect it and check the water, they're gonna be able to fix it and tell you what's wrong with it right there versus having us inspect it or any health district inspect it and then come back, then I have to hire somebody again to come back and say, okay, what am I doing wrong with my water here? So, I mean.
Test it again.
Yeah, exactly, and have it tested again, and in the end, I think that costs more for everybody, so it would seem like that would be one thing we should just give back to the public and let them take care of it themselves. You're not gonna get in a pool if it's disgusting, I'm not. I mean, you can kind of tell the water goes pretty fast. Doesn't look very good after, when things start getting off, so.
Well,
Something else.
we've only been inspecting a small amount anyway, is that correct?
Yeah, I think it's around 30, 50.
How many?
30 to 50 in our district. It's not very many. Most of our outbreaks, I could almost maybe say all, but I can't say that definitively, are from unregulated pools and splash pads.
And then hot waters, you know, any sauna areas, hot waters are heavy because the bacteria grows heavily in warm water, so.
I know there's also a bill on moratorium on, in committee now, moratorium on mRNA gene therapy that's coming forward. You guys have heard about that, but we'll see how that goes. But in favor of it as long as they continue to have no liability. You know, that's the concern is that up to this point over the last 20 years, they haven't been successfully brought a product to market without significant side effects, and kind of COVID opened the door for that product to be pushed through without liability and without long-term studies. Now they're kind of piggybacking on that as into cancer therapy, other vaccines. So the concern, I think, with the voters and legislation is it's just unregulated and without liability right now. So
I think that bill does exclude cancer and individuals.
it only applies to vaccines at this point, yeah. But they're bringing that's part of what I'm talking about, is they're bringing their cancer therapies under the umbrella of vaccines.
Right.
So you'll see cancer vaccines and coming forward and being produced right now. So, and there's a reason. It's because they can make it without liability. So.
As long as they can make money off of it, they don't care what they call it.
Well, there's no legal liability according to the PrEP Act, you know, which passed in '86.
Doesn't matter.
Well, yeah.
I lived through it, so I know how it doesn't matter. They don't care anyway.
Well, when a company has the potential for, you know, and many of the pharmaceutical companies have paid out billions of dollars, there's a big difference between being legally liable,
Sure,
civilly liable, and not paying at all. So And for the people that take those medications or are told to.
Well, yeah, I just know how I battled them tooth and nail, so.
Yeah.
I just gotta be very quiet because I'm
Yeah.
really angry about it.
I
Yeah.
feel you.
I'm
pretty sad.
extremely angry about it, so. Anyway. Are we done with the executive?
I think so, yep.
We done? Nikki?
Just a few updates for the board. One is our lands team would like to invite our board members out on some permitting for septic systems when they're out doing that. So just be advised that you may be receiving an invitation to come out and see that install process when they're out in your area. We had, you may recall, I feel like this has been going on for a couple of years, but maybe not that long, a tort claim on a subsurface sewage system that we had permitted in Caldwell in town. The lot, well, it's still, we've referred the situation to DEQ, but because we permitted a replacement system in a place that we couldn't and we caught the error, the landowner had already incurred costs. So the tort claim that is being settled. I just wanted to put closure on that from our end. We've settled that with risk management and the property owner, and we've referred that issue to DEQ because there is really no solution for resolving that. They're, I think, right around 300 feet from city services, and unless they were able to acquire some neighboring property, there's nowhere to put a replacement drain field. So.
What was the cost to the district today?
It wasn't to the district directly, it went through risk management,
Oh, yeah.
and it was $65,000 to someone. I was going to give a funding update. So some of our funding, as you know, comes through the state. Right now, it looks like we'll have level funding through those funds that are appropriated to us. Those are home visiting, citizen review panels, and Millennium Fund. And then, and that's been, the bill's been drafted on that. So as long as it moves forward, that should continue to go forward. For the sub-grant funds that we received through the Division of Public Health at the Department of Health and Welfare, they are still waiting for their JCAP to set that, and it sounds like it could be later this week or next week. So I don't have any updates on that yet, but just wanted to provide that. And then I think Commissioner Purdy and I already covered the legislative updates. So.
Mr. Chair, one more question on the legislative. I don't cover that, but they had one about sewers and septics when I expect the rural counties. Do you know what that is?
Yeah, that had to do with water and
It also allowed the commissioners to, it is on here.
Is that the domestic water bill?
yes.
I don't remember
Domestic water use.
if there's anything in there about septics.
I'm sorry, septic.
Not
rural,
sept,
but I do have the-
I thought it was solid waste. Is that the one you're talking about?
No, I saw one where they said something about where your domestic water and your sewer systems might affect rural counties and the people that are smaller lots, away from the city services.
Yeah, I think because of some of the requirements for the domestic water, and they are, we don't really have necessarily concern about it, but it sounds like it might be a little bit more rigorous in the planning and zoning for residential development of those areas.
Have you looked at that bill?
I have, but it's been like.
That's 1083.
Yeah, I've worked on that one, and there's, as far as I know, I mean, there are a lot of parts and pieces to it, but I don't think it has anything to do, I don't think it would change that at all. Really, the thrust of it is in areas that are of groundwater concern. It allows domestic wells to be curtailed just as if they had a water right, like an ag producer.
So if an area of groundwater, if it's an area that can be curtailed, a domestic well can be curtailed along with water rights. But I don't think there's anything to do with placement relative to septics.
I don't think we would want to make a situation worse, right? Like in high nitrate priority area or something like that. But are you thinking?
I don't think there was anything in there about that. It does require that in a comprehensive plan, groundwater is considered. So as far as that is concerned.
Where do they classify groundwater?
How do they classify
Where do
groundwater?
where's the depth they classify it as groundwater?
There's no, it just says groundwater has to be considered in a comprehensive plan, so that's pretty general.
Yeah.
So, I mean, there was.
There's sometimes surface water and sometimes groundwater.
Yeah, in North Dakota planning and zoning, we always see the final results of that, so I just wanted to know if there's anything going forward that I need to be aware of changing.
I
I'll go back and.
I don't think there's anything in there about that, honestly. Because there was discussion early on that would require subdivisions to put in a community well over a certain number of lots. That got taken out. So really, by the time the bill was discussed, and it did go to committee yesterday, and it was approved to move on to the 14th order for some amendments, but it was much watered down compared to what it was originally, so.
It'll be more watered down after it goes to the 14th, if it gets out of there at all.
Yeah.
No pun intended.
Yeah. Well, we'll take a look at it and watch it. And see if there's.
Yeah, I just always have concern with them zoning, and we need to make a change.
Yeah, I don't, there's nothing I can think of in that bill that would affect that.
Yeah, that's what my question is.
Okay.
I don't have anything else.
Okay. Anything on for the future agenda items? Anyone have anything they would like to have added for future? I will, next month, I will ask Zach Brooks to chair. I will be in sunny Arizona.
Here we go.
So, I'm leaving next week, so.
You want
I
to
will Teams in, but
I think we should all go to Arizona and have the meeting there.
I like that idea.
I do have a question before we adjourn. Any kind of a federal freeze on grants and kind of spending from the federal government, is that affecting the health district?
Yeah, that's a great question, Commissioner Eby. We have not received anything of concern at this point. Well, we received nothing, I should say, and including nothing of concern. So we are just going one day at a time and keep doing what we're doing unless or until the direction changes. So, okay. Good. Yeah. Keep you updated if we hear anything.
if there's anything that comes out, legislative way, which it won't be, it'll be executive order for now, but if there's anything that comes out, the board will get it, be informed of it. So we'll work on everything, making sure that, financially we can continue with the contracts that we already have in place. They've already been put in place. Now, any new contracts might be difficult.
Yeah, we have had some grants that we were working on applying for. One was actually, or maybe two, kind of one maybe was related to King County and that we would have collaborated on. Those have been frozen, those new opportunities.
Is that the pre-prosecution?
Yeah, and it's our grant writers, you guys met earlier today, indicated that they're not not available anymore. I mean, they may not be, but we're just watching and they're on hold for now. So those, we do know that. And everything that we're receiving currently has not been affected.
Okay. So in a case like that, do you continue to write that grant, or are you just?
Well, interestingly, the timing of them being frozen was like the date for the due date. So they were written and they're ready to go.
Okay, so if they open it up again.
Yeah, so we're ready. But yeah, for those others that, maybe we hadn't seen, what we're not doing. We'll obviously see or pursue because we don't see them. So.
Anything else?